Hello, my name is Shamika Anderson, and today I will be presenting to you the Baylor Scott and White Healthcare System. The purpose of this presentation is to communicate information that has been compiled as a result of research and analysis by myself and my classmates on the Baylor Scott and White Healthcare System. In this presentation, we will go over the strategies and competitive advantages of Baylor Scott and White Health, and also the tools and theories that we used to analyze the Baylor Scott and White Healthcare System. Let's first start off with a company overview of Baylor Scott and White Health. So they are the largest nonprofit healthcare system in Texas, as well as one of the largest within the United States. The system was founded when Baylor Healthcare and Scott and White Healthcare merged together. Today, the system has a total of 48 hospitals, more than 800 patient care sites, more than 7,800 active physicians, and over 47,000 employees, as well as they also have a health plan, the Scott and White Health Plan. Baylor Scott and White's mission is to promote the well-being of all individuals, families, and communities. They also have core values that they strive to always meet. Those values are to serve faithfully, act honestly, never settle, and they're in it together. Now let's talk about some of the strategies that Baylor Scott and White uses. Baylor Scott and White Health strives to be the trusted leader, educator, and innovator in value-based care delivery, customer experience, and affordability. The system uses the following strategies to do so. Health. Transform into an integrated network that ambitiously and consistently provides exceptional quality of care. Their experience. They achieve the market-leading brand by empowering their people to design and deliver a customer-for-life experience. Affordability. They continue to improve their cost discipline to invest in their mission and reduce the financial burden on their customers. Alignment. They ensure consistent results through a streamlined leadership approach and unified operating model. And lastly, growth. They pursue sustainable growth initiatives that support their mission, ambition, and strategy. Now let's talk about the products and services that the Baylor Scott and White Health System offers. They have establishments that are targeted to cover all individuals, as well as establishments that target specific needs in populations. Their facilities include hospitals, rehabilitation centers, primary care clinics, specialty care clinics, ambulatory surgery centers, senior health centers, urgent care clinics, retail pharmacies, and home health care services. Alongside of all those growing facilities, they also offer the Scott and White Health Plan. This plan was founded in 1982 as a nonprofit health maintenance organization. The health plan serves over 220,000 members across 77 counties in the Central, East, North, and West Texas regions. The Scott and White Health Plan offers the following types of plans. They have individual plans, family plans, small and large employer plans, Medicare Advantage plans, prescription drug plans, and also Medicaid plans. They also offer a variety of classes and events to not only their patients, but also their staff members. Some of those classes offered are CPR and safety courses, senior exercise classes, diabetes self-management education classes, childbirth classes, and also support groups. One of the tools that we used to analyze the Baylor Scott and White Healthcare System was the SWOT analysis. The SWOT analysis goes over the strengths, weaknesses, opportunities, and threats of an organization. Some of the strengths that we have for Baylor Scott and White are an effective network, a strong reputation, strong leadership, and the recipient of numerous awards and recognition. One weakness that we found was the lack of geographical concentration. The opportunities that we have listed here are expansion of demographics, an increase in health expenditures throughout the United States, and an increased in pay to market value. And lastly, threats. The threats that we found for the Baylor Scott and White Health were lack of skilled health professionals and strict government regulations. One of the theories that we use to analyze the Baylor Scott and White healthcare system is the Miles and Snow theory. Miles and Snow propose that organizations in general develop relatively stable patterns of strategic behaviors in order to achieve a good alignment with the perceived environmental conditions that they faced. They included 4 strategic types. Those strategic types are defenders, prospectors, analyzers, and reactors. We felt that Baylor Scott and White would fall into the prospectors strategic type. Prospectors tend to thrive in innovative, dynamic environments, and they capitalize on growth opportunities. Baylor Scott and White models this behavior with their continued success with their population health strategies. Within the Baylor Scott and White Health North Division, the readmission rates dropped by 15%, and their admissions per 1,000 were reduced by 9%. Based off their internal projected analysis, there was a $10 million savings in medical cost, all within 2 years. Clinical integration is considered essential to true systematic change and meaningful improvement that expands coverage, improves quality of care coordination, rewards effective and efficient care, and promotes innovation and helps control cost. The Baylor Scott and White Quality Alliance was able to achieve these elements of meaningful reform after just 2 years of being in operation. In doing research on Baylor Scott and White, we found their top 3 competitors. Their top 3 competitors in the hospital sector are Texas Health Resources, HCA Healthcare, and UT Southwestern Medical Center. When it comes to revenue, Baylor Scott and White is ranked 3rd among these particular Texas systems. Out of the 3 competitors, HCA Healthcare ranks the highest when it comes to revenue. HCA, while headquartered in Nashville, Tennessee, operates 53 hospitals in Texas as of 2018. HCA generates an estimated revenue of about $47.8 billion compared to Baylor Scott and White Health's $1 billion, Texas Health Resources $2.3 billion, and UT Southwestern's $19 million in revenue. Baylor Scott and White Health has many strengths and opportunities which result in the ability to have constant room for growth. Our team came up with the following recommendations for Baylor Scott and White Health to stay competitive. The first is to improve the organization's geographical concentration. While it is always important to be well established in developed cities, small rural areas are also in need of medical services. With Texas being the biggest state of the United States and having an abundant amount of smaller areas, it is important that all residents have access to medical services. Also, we recommended that they expand services to include long-term care. With a steadily increasing rate of baby boomers retiring, it's important to have a well-established long-term care facilities that can provide the necessary services for their population. Another recommendation we have is to increase the education for aspiring medical nurses and physical therapists, as well as public health. Increasing the education would result in an increase in educated healthcare professionals, and concentrating on public health would improve compliance and success with national patient engagement, such as satisfaction surveys. Also, we recommended that they expand the current telehealth or telemedicine program. Currently, as a patient of Baylor Scott and White Health, you can schedule an e-visit to help with treatment of ailments such as a cold, the flu, a bladder infection, acne, or allergies. The service will provide you with a diagnosis and recommended treatment and also provide prescriptions if needed. A beneficial expansion of this service would be to include other services such as chronic disease monitoring and management, disaster management, care management, and caregiver support and counseling. In closing, Baylor Scott and White Health Care System is an established, large yet growing organization. While the system's facilities are in Texas, they are recognized nationally. Baylor Scott & White Health utilizes research and analysis to communicate information and aid it in the continued success as a top healthcare organization. Baylor Scott & White holds their missions, ambitions, values, and strategies high as to lead their business aspects and provide guidance towards the development of their business. While there are things that the organization can work on, there is no doubt that Baylor Scott & White Health will continue to receive both local and national recognition and further improve their rankings if they continue to analyze and strategize within the organization. Thank you.